A better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We're asking experts your questions every day at 3 to get answers for you in real time. Today, we have the director of Measure of America to break down a new study into the quality of life for Californians. Huge differences in life expectancy, in pay amongst different groups, racial groups, as well as genders. We're going to dive into that and ultimately have some takeaways on what may lead to a longer, happier, healthier life for you. But first, it's a big concern that is on the minds of so many parents across California, the safety of children in the classroom. Many students got tested for COVID before returning from winter break, but testing kids are still hard to find amidst this Omicron surge. So what about the remainder of the school year? Joining us live now is State School Superintendent Tony Thurmond. It's been a while, so Superintendent Thurmond, Happy New Year. Great to see you.
Happy New Year, Kristen. Great to see you as well.
All right. I got to say, it was a huge feat, I know, handing out more than 6 million test kits to California school students. I think they number in 6 million. So theoretically, everyone should have gotten one. But the reality is we have heard local school districts that were not able to get them out before kids had to return to the classroom by this Monday. So talk to us about how you're feeling about that.
You're right, Christine. It's a logistical feat to getting tests all across the country, and all of that up against really the backdrop of rapid tests really not being available anywhere in the country. As a parent, I know that I've been visiting drugstores and unable to find tests, but grateful to our partnership with the governor and the California Department of Public Health that they were able to secure more rapid COVID tests and take-home tests. A lot of school districts were able to get their tests early and to get them out. I know at West Contra Costa, they handed tests out before school started. Oakland did as well. And I got to say, big shout out to Castro Valley, where they invited me out last Friday to hand out tests to families directly. And
we have video of that. In fact, we're looking at it right now. There you are.
Yeah, the folks out in Castro Valley really mobilized very quickly, really giving families 2 boxes of tests for each student, one to take on Friday and one to take on Sunday, really trying to time it. But unfortunately, that's not the case for every single district in the state. Many of the tests are still deploying, and some have been delayed because of weather concerns. But folks at the Department of Public Health are literally working around the clock to keep getting those tests out to our schools.
I'm going to come back to tests in a little bit because I know you've said that is a key pillar to keeping kids in school this semester safely. But I want to get to major news just announced by Dr. Mark Ghaly, our state's Health and Human Service Secretary, saying that California is going to extend the indoor mask mandate through February 15th. They were going to revisit that on January 15th, and a lot of people expected that to only be a month. I know with regard to schools, they've kept it, right? That there was never an end date that was circled on the calendar. What are you expecting in terms of masking in schools, how long that may continue?
It's a wise decision, for masking, especially because schools are only able to have limited social distancing, and masks have been an important part of the equation, right? As you said, it's masking, it's COVID testing, and of course, we want to remind everybody the importance of vaccines and boosters and, seeing how now boosters are available to younger children. I know that in some places like San Francisco, they say maybe 50% of children between the ages of 5 and 12 have received vaccines. The Bay Area leads many parts of the state in the country, but we have to keep doing more. And having masks is going to be important to maintaining our safety in schools, in restaurants, in the community, and keeping our businesses and our communities, keeping everything open.
Yeah. All right. I also want to touch upon this. Dr. Ghaly mentioned that with Omicron, cloth masks may not be enough, but we know that's what a lot of kids have been wearing. Are you doing anything to support schools being able to distribute freely KN95s, N95s, better masks, which, as we know, are both hard to get and very expensive?
We don't want to make cost the issue. And KN95s are great. In the meantime, a surgical mask is good enough to use and better than the cloth mask. And so we've been promoting that messaging for some time. I just took my mask off to come into a room where I'd be by myself to speak to you all. But I keep the surgical mask with me at all times. The state has worked in partnership with the governor's office, with the Office of Emergency Services, and our office, and our county offices of education. We literally have moved these kinds of supplies since the earlier parts of the pandemic. This is going to be the way we're going to have to continue to work. And we know that there are sometimes challenges. And so even just today, I've started inviting some of our educational groups, our partners, to come together to talk about how do we make distribution happen better? How do we plan for the future? Schools have been given billions of dollars to purchase these supplies, but sometimes they need the state's purchasing power and the resources that the Office of Emergency Services can muster to make sure we have enough supply. We'll keep working with all of our state partners to support our schools in doing that.
Economies of scale, right? So glad the state is involved in that effort. Look, given all these factors we just discussed, including, I know you're trying to ramp it up, but still fewer than half of school-age children in California are actually vaccinated fully right now. Given that, given the Omicron surge, given the challenge in finding tests in the community, are you a little bit holding your breath as kids all return to school?
I mean, I'm a parent, and I've got kids in our California schools, and we're always worried and about the pandemic and about coronavirus because it keeps changing. But if we do the things that we have learned, these are the constants that we have learned: wearing a mask and getting a vaccine and getting a booster, that all these things work. What we've seen that does scare us all is that there are more hospitalizations of children from the Omicron variant. But what we've also seen, it is those who don't have a vaccine who experience serious consequences. So that's telling us this is the path to keeping children safe, to keeping adults safe, keeping schools and businesses in the community open.
Well, yeah, but the big fear for a lot of parents, I got to be honest, I mean, you're a parent, I'm a parent myself, is that schools may shut down in-person learning again. We saw that before. How probable or improbable is that scenario?
I can tell you that everyone's doing everything that we can to keep schools open. In California, at the start of this school year, really has been amongst the schools that have closed the least amongst all schools in the nation. Very small percentage of schools closing in California starting the school year. Again, it's because of vaccination rates, it's because of the mask mandates and using masks and social distancing in our schools. We're doing everything to keep them open because we know that when school was closed and distance learning, kids experience high rates of depression. And we've got to continue to keep our schools open to support our kids and support our families. And so that's what we're working on. We're working on proposals to get more counselors to help offset that depression. Today, I announced a program that's going to help us recruit 10,000 more mental health clinicians to really support kids. And so we want to do everything that we can to keep our schools open, to support them and to support their families.
How is that going to work? I mean, how quickly will the 10,000 be able to get to work, so to speak? And how will they work with students in your mind?
Well, the 10,000 will take some time because this is a new proposal that we're just introducing into the legislature and the legislative cycle that just started on Monday. And so what we're trying to do is raise $250 million for scholarships and loan deferrals, increasing the time or reducing the time that it takes for one to get to licensure for those who are becoming master's level clinicians and licensed clinicians. Right now, though, there are programs that we can use through Medi-Cal and other programs to provide more counseling supports. But every single school in our state is experiencing a shortage of available clinicians. And so that's why we introduced this proposal to try and accelerate the number of staff who are available to help with mental health needs.
Yes, absolutely. Anecdotally, I know so many kids are in need of support right now, and the data backs that up. So we'll see where that goes. Glad it's underway. I do want to ask you to stay here with us because we'll come back after a short break to talk more about school policies, including some districts that are now canceling spectators for indoor sports and other measures. So we'll be right back. Superintendent Thurmond, thank you so much. So great to have you right now. We're on Facebook Live and YouTube still streaming right now while we take a short commercial break. So I want to get to a few questions that our viewers have for you. This one is not necessarily school specific, but Kathy wants to know about, all the home COVID tests being done, including the ones that the kids did, that are being recorded in the daily counts. If somebody doesn't reach out to the provider with a positive test, that may not be counted. Is that being taken into account? I do wonder about that myself with regards to the ones that the school sent home, because I know from my kiddo's school, it's like they want you to take it, but there isn't this strict rule to say you cannot step your foot on campus if you didn't take it. So what if somebody used it at home and they're positive, but they decide, no, I actually want to come to school because I'm not feeling sick. They don't report it. Are you worried about that?
We worry about all these things. And again, we encourage anyone, if you have any symptoms at all, stay home. That's the whole point of having these rapid tests, so that someone has a positive test, they can stay home and quarantine safely while we keep the rest of the school community safe. So that's something that we do worry about. But I have to say, there's been a lot of information provided by our school districts all across the state where they said having the take-home test and working with county health providers ahead of the start of school, they were able to identify many people who were positive, and that's going to ultimately keep us all safe at our school communities.
Yeah. I mean, is there anything that can be done to not force compliance, but that everybody uses those kits that they were sent home with?
There are some districts that are, now establishing policies that require, in order for someone to come back, to show that they have a negative COVID test. I know that in Los Angeles Unified School District, for example, and they start school on Tuesday, they're expecting everyone to show a negative COVID test as part of returning to school.
Okay. Thank you very much. We have 15 seconds before we come back, so here's your chance for water break. I forgot my water, Superintendent Thurmond.
You're always ready.
All right, here we go.
3, 2, 1.
And we are back with California State School Superintendent Tony Thurmond. Really great to have you as kids are all coming back to campus, going back to school for the spring semester amid the Omicron surge. Superintendent, some districts like in Marin County, we know, are canceling their indoor assemblies and banning spectators from indoor athletic events such as basketball. San Mateo Union High School District is limiting spectators to 6 per athlete. Which approach and what types of approach to management do you support?
Well, I got a call just as a parent, a robocall saying that our school district was temporarily canceling sporting events. And so now the practices have been different district to district. A number of districts had already been using rapid COVID tests for athletes and for after school activities, so they feel that they're capable of continuing these programs. Others may say that just because of the sheer size of participation, we need to really wait and give it some time and to see how things go. And so we're seeing different things at various districts, but we are seeing everyone taking special consideration on how to keep our athletes and the participants in our after-school program safe.
Edwin has a question. Is COVID spreading in public schools, and how fast? Look, there isn't a definitive answer to that except to compare it to the community at large. And when we look at what happened in the fall or during previous outbreaks, were the school environments any more dangerous than the community at large, or were they actually safer due to the mitigation measures?
Thanks for the question, Edwin. And Kristen, you pretty much, answered it spot on. The data that we saw coming into this new year is that kids didn't get COVID at school, that typically if someone had COVID and they came to school or work, that's how someone else got exposed to COVID. So these mitigation measures really do work. Most of our schools are working on using COVID testing. In the beginning of this school year, we'd already secured 3 million rapid COVID tests and for free for our schools so that they could have awareness. We had a great partnership with the governor and CDPH on how to get those disseminated so that people would have awareness for that very reason. It's typically the case that someone had COVID and came to school or work, and then others got exposed to it, which is why we want everyone to test, get vaccinated. If you have even just a slight symptom, stay home. Keep everybody safe at school, and you can safely quarantine at home.
That's right. All right. Big news today. Chicago canceled classes today for public schools after the teachers union voted to go remote instead of going back into the classroom. Could that happen here in California? And if it did, what would be your stance on it?
Well, we're all doing all we can to make sure our schools stay open, first and foremost. And I have to thank all of the educators all across our state who are really working under what feel like impossible conditions. And they're committed and they've demonstrated their commitment. We know that a lot of educators literally have been out, either because they've had COVID or they've been exposed. But we've had others stepping in. We've had folks stepping in. We've had administrators helping to manage classrooms in San Francisco and other places all across the state. This is happening, and we want to acknowledge those educators. We want to acknowledge our parents and our families. Let us do all we can to keep school open. We know how important that is, and right now, all of our education groups are working together to do all we can to keep schools open.
Yes, but the reality is a lot of people are out. We saw it in the airlines industry, right, with all the cancellation of flights. My kiddo's school district sent out an email saying, hey, those lunch lines may be longer because we just don't have as many people working those lines. And, so I sent him to school with a packed lunch, but I know a lot of parents can't. Bottom line is, do we have enough people in the pipelines who can step in and help out, whether it's substitute teachers or staff?
We don't. We're seeing staff shortages that we've been seeing even before the pandemic. They've grown and exacerbated in the pandemic. Yeah. I've named a new working group that's going to focus on just one thing. How do we recruit more staff to work in schools in the state of California? By the way, this is a nationwide challenge. Workforce shortages is an issue all across the country in every single sector. But this new work group is going to give us ways to think about what do we do around compensation, around training, affordable housing. As you know, in 2019, I led an effort that got us more funding for building affordable housing for educators, because one of the biggest challenges is folks can't afford to live where they work. And so we're going to look at all these issues. And again, anybody who wants to be a part of our group that's focused on workforce recruitment, how we support them, we welcome you to be a part of our efforts. This is a top priority for us in this state. And we're going to do all we can. We need bus drivers and classified staff and teachers and substitute teachers. We're working on a number of proposals to help keep 15,000 teachers who are teaching right now in our classrooms who need some additional training to complete their requirements. We're working on some proposals to do that. We're going to do all that we can to help build out the workforce in California.
Do you know what percentage of California teachers and staff are actually vaccinated? I know there is a state mandate, although it does give the testing option still, as I understand. But reports suggest that many districts are not really enforcing that policy because they simply can't afford to lose anybody.
Well, I'm going to see if I can get you a stat before we end our time here today. I don't have one right in front of me, but I know that from the beginning of the school year, we have seen that amongst teachers, some of the highest rates of vaccination anywhere in some of the national teaching organizations, as well as the state teaching organizations, the California Teachers Association, California Federation of Teachers. They had encouraged their members to get tests. Now, I know at the beginning of the school year, we heard some rates across the country, coming from some of the national organizations saying that teachers might have been 90% vaccinated. But we're going to work to get you some data that we can share with you before we leave here, and see if our team can get us a stat that we can share with you.
Thank you so much. Look, I know you would like to see the school-age kids' vaccination rate be higher. So let's talk about that. What are you doing to make it as easy as possible for kids to get their shots if they haven't yet? As we know, there's a state vaccine mandate for kids, too, although the deadlines have been kind of extended. But what are you doing on that regard? In that regard?
We've been doing vaccine clinics, walk-up clinics. We've made it so you don't need an appointment. We've done outreach to families. We do town halls. We get celebrities to speak on it. We get young people to speak on it. We do all that we can. We even give out incentives. And every chance we get, we promote vaccine outreach. Right now, we're working on a campaign with a group called Ándele que esperas, Why Wait? To help us reach 4 million more Californians. And we're constantly thinking about how we support young people. I've got two daughters, two teenage daughters. They both have been vaccinated. One's already gotten a booster. We continue to promote it. I got my booster in public as a way of trying to send the message to folks that it's okay to do, it's safe to do. We're going to continue to promote vaccine outreach, because as important as testing is, it's vaccines that's showing us the way to have safety. Now, the state will have a vaccine mandate that will probably roll out at about July. And the point of that is to say that it creates a way for students in, say, grades 7 through 12 by July to be able to get a vaccine under this mandate, and then to work with students younger than that. But we try to get past the mandates and just encourage people. This is about saving lives This is about keeping schools and businesses in the community open. And we'll continue to encourage everyone, please get your vaccine. And when you're eligible, get a booster.
All right, and on that note, we'll end this conversation, but let's have it again another time. Superintendent Tony Thurmond, thank you so much for joining us today.
Thank you, Kristen.
Take good care. Coming up next, we'll talk about the quality of life here in California. A new study is breaking down the key indicators. We're exploring what the research means for various ethnic groups and also men and women. We'll be right back. All right, everybody. I always enjoy having State Superintendent Tony Thurmond on. He is great at communicating on the state level what's happening with regard to keeping school kids safe and education and all those matters which are so concerning to parents right now. So thank you so much. And some of you had great questions. Some of them I saw were great questions, but were probably more suited for Dr. Patel or Dr. Monica Gandhi, one of our regular doctors. So if I didn't get to it, don't worry, because we have Dr. Patel on at 4 o'clock. So more information coming your way. All right, let's see what some of you are saying. Kelly, you're saying 12 to 15-year-olds cannot schedule a booster. You know, I have a feeling you will be able to do that very, very soon. As I understand, sometimes it takes a few days after the initial FDA advisory panel vote, and then you need the CDC to sign off after that, and that might take a couple more days. So I'm going to bet that before the end of this week, you should be able to do that if the past is a good indicator of what will happen this time around. So there you go. What else are we saying here? I don't think any educator would intentionally come to work ill during a pandemic. No, I would highly doubt that. There are students, anecdotally, that we've probably all heard of who don't really have symptoms, whose parents send them to school anyway. So that has happened. We've reported on cases of that. And those are, you know, I mean, you want to avoid that, right? You don't want to do that because you could infect other people. And even if you didn't get very sick or your kid didn't get very sick, somebody else might.
10,
All right.
9, 8, 7, 6, 5 seconds, 4, 3, 2, 1.
Health, standards of living, and education. A new study is taking a look at these three components that are crucial to living a good life and is focusing on the state of California. It's called The Portrait of California. It comes from researchers at Measure of America. The study provides a detailed picture of the well-being of California residents broken down by race, ethnicity, and gender. Joining us now to talk about the findings amongst Asian Americans specifically is the director of Measure of America, Kristen Lewis. Kristen, nice to have you here. From one Kristen to another.
Yeah, I'm always happy to talk to another Kristen. Thanks so much for having me on.
Right? I had not heard of the Portrait of California before. Talk to me about the study and what it sets out to do.
Sure. So Measure of America is a project of the century-old Social Science Research Council, which aims to mobilize social science for the public good. And our project in particular really helps ask the nation how it's progressing by focusing on indicators about regular people rather than the focus on economic indicators that we typically see with a focus on GDP. And the way we do that is we use the American Human Development Index, which is a composite measure of well-being that combines the latest and best data on health, education, and living standards into one number that goes on a scale from 0 to 10. So we use that to create scores for racial and ethnic groups, for places, and for places over time. We did a first report of Portrait of California 1 in 2011. And so that was a decade ago. So this report revisits that and looks at well-being and access to opportunity across the state.
So what is the biggest finding with regard to life expectancy? That's what everybody wants, to live a long life. Which group lives the longest life?
Asian Americans live the longest life by a significant margin. So Asian American baby born today can expect to live 87 years. And if she's a little girl, she can expect to live 89.3 years. So that's quite an amazing average, almost 90 years for Asian American women. One thing I
But
did want to note, though,
I do notice a big difference, though, between the Chinese ethnic group and the Hmong ethnic group. What does that tell you?
well, I think it's really important we always disaggregate whenever we can findings for Asian Americans. Asia is home to 60% of the world's population, almost 50 countries. So naturally, the Asian American population in California is extremely diverse. So we see tremendous differences, even if we look at the index combined, even if we don't just say life expectancy. Let's look at the index as a whole, which again combines life expectancy, access to knowledge, which is educational attainment and school enrollment, and then living standards, which is median personal earnings. Those are the indicators we use. And we see that Taiwanese Californians have a score, again, on our 10-point scale of 9.58. So this is one of the highest scores we see anywhere in the country. And on the other hand, if we look at Hmong Californians, their score is 4.33. So that's well below the California average of 5.85. So when we don't disaggregate among Asian groups, we overlook the fact that some Asian groups are really struggling. So Laotians, Cambodians, and Hmong Californians have much lower scores than other Asian groups in the state.
Health, standards of living, and education and financial situation, they're all intertwined, aren't they?
They are, but we do see some findings that might surprise some people. For instance, usually life expectancy fairly closely tracks educational attainment. So the world over, the more education a population has, the longer life it tends to have. But for instance, for Latino Californians, we don't see this link. Latino Californians live the second longest of the 6 major racial and ethnic groups in the state, but they have the lowest educational attainment score. So here it's broken. It doesn't always follow.
What do we attribute it to? Is it, maybe closer relationships? Is it overall sense of happiness? Is it something else? What is it?
So it's a great question, and lots of people try to answer it. So for a long time, people thought it might be the healthy migrant bias, that in order to have the sort of stamina and wherewithal to go to a new country, it's hard to be an immigrant, you had to be unusually healthy. So maybe that was the reason. The people who migrated were healthier. Another is the salmon bias theory, which is that people might go home to their home countries when they're sick, and so then their deaths aren't recorded in the US. So there have been a lot of studies. None of them are really conclusive on either of those points. There is data to suggest that family cohesion, social support is a factor, especially, for instance, in the healthy pregnancy outcomes you see among Latina women.
Well, Kristen, we are out of time here, but I hope there was something in that conversation to take away for everybody. In the meantime, we'll take a short break and continue the conversation on Facebook Live.
Great.
All right, Kristen, we are off the air, but we're still streaming on our streaming platforms. So I'd like to conclude by asking you then, look, has the pandemic changed these things? Because I know you started the study before the pandemic. Do you see any drastic shifts or changes?
Well, what we're thinking of is, especially when we look at the scores by place, we're thinking of it as almost a vulnerability map, because these scores were calculated prior to the epidemic, like in 2019. And the areas that had the lowest scores in struggling California, say scores below 4 or even below 5, those are the areas that were at the greatest risk before COVID. They were the hardest hit by COVID, and they faced the greatest climb to recovery. So we really advocate that recovery dollars be focused on those places that scored the lowest prior to the pandemic.
Ah, I see. So there is social policy implications here with the findings. That makes a lot of sense. Let's break down the men-women differences a little bit, because I know when you looked at Asian Americans, there was a huge disparity between how much the men and the women made, yet the women live longer lives. What's going on there?
Yeah, so basically, Asian Californian women earn about $40,000, and their male counterparts earn about $60,000. So that's about 75 cents on the dollar.
Which is a worse ratio for women than when you look at all the, all the racial groups together, society as a whole.
Yeah, it is. It's not quite as bad as the white gender gap. So white women earn slightly less than Asian women, and white men earn slightly more. So the gap is bigger for them, but this is the second largest gap. And it is because of the outsized earnings of white men and Asian men compared to all other racial and ethnic groups in California.
I see. Kristen Lewis, this is really interesting stuff. I wish we had more time, but folks can read up about it. This is the Measure of America, Portrait of California. Thank you so much.
Thanks so much for having me.
5 seconds. 4, 3, 2, 1.
Thanks so much for joining us on this interactive show, Getting Answers. Today, we answered your questions about COVID testing in schools, the indoor mask mandate extension, and also a new study about the quality of life in California. See you back here tomorrow at 3. Bye-bye.